Hello, my name is Harry Mortimer and I've previously been involved with the development of the Dissect Revisited website, and now it's my pleasure to introduce Professor Duncan Bell with his new video, Curious Calcification.
Hello, I'd like to share with you some very recent micro-CT observations that we've been making in bees and wasps, particularly looking at this appearance, which appears to be due to calcification within the wall of the midgut. I'm going to be acknowledging the very considerable help of everybody listed here as we go through. You may challenge me to say, how do I know that this is due to calcification? And I would say I don't, but there's quite a good discussion on the possibility in Snodgrass's wonderful book. So, by way of background, George Balding and I earlier this year produced a video on the radiological features of a vespular wasp. You can get this by going on our website and downloading the video. But basically what we said was that if you use micro-CT and cut in to the middle of the abdomen in a sagittal or parasagittal plane, the typical appearance was something like this shown. In other words, taking the gastrointestinal tract, the intra-abdominal gastrointestinal tract, it was commonplace to see the crop, which was extraordinarily dilatable. You could see the valve separating the crop from the midgut, but most of the midgut and most of the rest of the gastrointestinal tract and other intra-abdominal organs, such as the reproductive ones, were usually fairly obscured because they had a very similar radio opacity. What one did, however, see very frequently was small amounts of much whiter material, much more radio-opaque material, which we presumed was material that the wasp had ingested. And this was in essence what we found in some 31 wasps. However, I'm very grateful to Dr. Cynthia Oy and Professor Serian Sumner from University College London for permitting me to show two scans that they did on mature old queens who had established nests and were actively laying eggs. And you can see this very typical appearance, which is the midgut. We had expected we might see radio-opaque material in their nathal pouch. We had expected we'd find a relatively low attenuation eggs, but we had not expected to find this calcification within the midgut wall, which appeared to be in the circular smooth muscle layer. This is the second of Cynthia's old queen wasps, who again showed the identical appearance. Again, with it being the calcification, in other words the whiteness, the radiopacity being greater in the distal than the proximal midgut, which goes right up to where it joins with the crop. So we, by way of background, had found this appearance in only 2 of some 33 vulgaris wasps, and we were interested in trying to find out whether it was an effect of aging, and also to look at a few other wasps and bees and ants, in other words the Hymenoptera, to see whether this occurred in others. We were very anxious that we should confine looking at the calcification in the midgut and not radio-opaque intraluminal material, which was presumably due to the wasp or bee or ant ingesting the material, or in newly emerged adults material that had been excreted from the Malpighian tubules into the hindgut as part of the meconium, but had not yet been passed. So, a few acknowledgements. I'm very grateful to ETAIN, the European organisation which is actively exploring the impact of radiofrequency electromagnetic fields on planetary health. They're particularly looking at the effect of RF EMF on insects, and one way they're doing it is through scanning as many different types of insects as they can using micro CT, and then doing lots of interesting things with the models thereby produced. I was very lucky that Philippe Oliveira Ribas from Ghent University and Dr. Arno Tierlens, plus Professor Matthieu Boone from radiology, have permitted me to look at their data sets of a number of different bees. This gives the background to the data. It gives you the URL into ETAIN's insects, and also how you can go into their Sketchfab page and download some interesting models, of which these are well worth exploring. To date, these are the different species of wasp and bee that we've looked at. The vast majority of the bees, thanks to Philippe and Arno and Professor Boone. The one and only hornet we've got so far was actually from my sister, Dr. Diana Hudson. She, I mean the Hornet and not Diana, was a bit of a disappointment because it didn't show this classical calcification, but it did show the much commoner phenomena of radio-opaque material, presumably as a result of the hornets ingesting same. We were rather luckier when we came to an Ammophilia wasp provided by Professor Sumner and scanned in Belgium by NeoScan, and here you can again see this typical calcification in the midgut circular muscle. Turning now to Philippe's bumblebees, both showed this appearance. The second of the two data sets showed not only material in the midgut but also intraluminal material which seemed to be in the bee's crop and distal bowel, as shown here, and here, and here. Right. What about his other bees? Two common honeybees, both I was pleased to see showed the same appearance. The wool carder bee didn't show it, and you'll have to take my word for it, but this calcification was actually in one of its legs or adherent to it. We had one leaf cutter bee which again showed the calcification, and in fact it looked as if it was not only in the muscle but also to a certain extent in the lumen. One of the most interesting was the Osmia bicornis, the masonry bee, of which 6 specimens were scanned, 4 females and 2 males. Now there was a lot of radio-opaque material in all of these bees, but it did not appear to be in the circular muscle of the midgut, but seemed mainly to be in the distal midgut and throughout the large bowel, in other words the anterior small intestine and the rectal pouch and rectum. These are other examples of very large and obvious amounts of radiopaque material in the distal bowel. Here's yet another one, and the males, the 2 males, were showing the same thing. This one particularly impressively. I thought this was rather reminiscent of what we'd seen when we'd scanned blowflies shortly after ecdysis, and I went back to Philippe's data sets, some of his CT animations, and looked in more details of one of the masonry bees, particularly this one of a cocoon, a pupa at a stage just before the bee broke out of its cell, and also this one. You can see the head, thorax and abdomen and legs, and here's a whole lot of radiopaque material in its distal bowel, presumably meconium. And here is one of the bees that I also looked at, showing material again in the hind gut. So I did just wonder whether this was some meconium. Finally, we looked at one of the largest of the European bees, the carpenter bee. Now, it interestingly had lots of radiopaque material, particularly in the distal esophagus, the petiolar esophagus, and the crop, and a little bit in the proximal midgut, but there was no evidence of muscle calcification. Normally, wood has a relatively low attenuation, relatively at least to water and soft tissues, but there seemed to be no doubt where it was, and so presumably the carpenter bee was ingesting a certain amount of material for some reason. So in summary, we've looked at 48 scans of either wasps or bees, no ants yet, and in 8 we've been fairly convinced that they had midgut circular muscle layer calcification, which was quite unlike that in the bowel lumen. We'd love some feedback. Obviously further studies are required, but as Snodgrass said all those years ago, most insects don't have a bony skeleton. They don't have a need for nearly as much calcium as we do, and it looks as if the small intestine, as well as the Malpighian tubules, may be one way of getting rid of it. I look forward to hearing your views.